Hello, everyone. Thank you so much for joining our webinar. We will wait for a couple of minutes so that everyone can join, and we will start the presentation in a couple of minutes. Hello again to newly joined attendees. We will be waiting for just one more minute, and we'll continue with the presentation. All right. Good evening, everyone, and thank you so much for joining our webinar. We have already quite a few people connected, so thank you so much for making this event a success. I'll quickly introduce myself. My name is Daria. I will be your host for today, joined together with our great speaker. The topic for today will be hydration support and encouraging voluntary fluid intake in cats. Couple of things before we move on with the webinar. So actually 3 things. The questions, if you can please submit them in the chat. We will be answering them at the end of the session. If you have any technical issues, please contact purina.arabia@ae.nestle.com and we will try to help you. And in case, hopefully you will not have any troubles, but in case any troubles, please contact us. Our webinar will be recorded and we might use it in the future for our internal or external videos or presentations. So the names of the participants might be visible in the recording. And I'm very happy to introduce you our great speaker for tonight, Dr. Sarah Caney, who is an internationally recognized specialist in feline medicines. And I'm sure you will enjoy the webinar as much as I do. So just a small note before we start, the webinar itself is pre-recorded. However, Dr. Sarah will be joining us shortly and she will be answering any questions that you might have before during the Q&A session in live. So she will be with us shortly. I hope you will enjoy this webinar. I'm getting the notes that there is no sound, so I apologize for a slight connection issue. So let me please try to re-log in again, and I will try to fix this issue right away.
Hello, and thank you for choosing to listen to this webinar. My name's Sarah Caney, and I'm a UK-based specialist in feline medicine. The focus for this webinar is really talking about some situations where it might be helpful to support fluid intake and hydration in cats. And there are actually a few situations where that might be indicated. The first situation is those conditions where cats have a polyuria associated with their illness, for example, cats with chronic kidney disease, and therefore to maintain their hydration, they need to drink more. So all of these situations, hypothyroidism, diabetes would be other examples, support of fluid intake can be really helpful. There are some other conditions when increased requirements for fluids might be present, and that would include cats with perhaps long-term diarrhea, perhaps watery diarrhea, and also cats with severe generalized skin disease, perhaps exudative skin disease, or cats where there is a lot of over-grooming due to pruritus and therefore loss of saliva and loss of fluids through that pathway. And again, these cats may benefit from additional support of drinking. Older cats as well present more challenges for us. It is known that in older cats, the thirst response doesn't tend to be as good, so they're less likely to drink as much as they perhaps need and therefore are a bit more vulnerable to becoming dehydrated. And also these older cats are more vulnerable to health problems, which can also affect their drinking. For example, osteoarthritis is very common. That might affect our cat's ability to get to the water bowl and to drink comfortably. Also, cognitive dysfunction syndrome, the cat equivalent of Alzheimer's disease, is very common, and that might mean the cat forgets where its water is and perhaps forgets when it's going to look for a drink. And that too can also leave these cats more vulnerable to dehydration and therefore mean that elderly cats in general, I think, benefit from supportive drinking and support of their hydration. And then lastly, some other conditions where supportive drinking, supportive hydration is certainly beneficial would include cats with constipation. Certainly we know that dehydration can increase the risk of constipation, but also in those cats vulnerable to constipation, it can be helpful to increase their fluid intake so that the feces they produce are as soft and easy to pass as possible. And lastly, we do know also that cats with lower urinary tract disease benefit from increasing a fluid intake and producing more dilute urine. And we know that that can help cats not only with urolithiasis and urethral plugs, but also cats with idiopathic cystitis. So that was a quick run through of some of the situations where it's helpful to support drinking. I'm now going to go through some case studies and show you the sorts of tactics that I use to try and encourage drinking in my patients. And the first patient I'd like to talk about is Buff, and you can see Buff very loved by his owner, lots of lovely photos that they have sent me, and this is Buff taken some time before I saw him, and you can see looking in quite good condition and very much enjoying the outdoors. The story with Buff was that he was a rescued cat. He'd actually come from Thailand and his age was not known, but he was known to be an older cat, suspected to be an elderly cat, around about 11 years of age. And about a year before I became involved in his management, he had been diagnosed with chronic kidney disease. And he had initially been doing quite well. He transitioned onto a therapeutic renal diet, but in more recent months, he'd started to deteriorate and his owners were worried that his appetite was quite poor. His vets were concerned that his azotemia seemed to have got a lot worse and his quality of life was really suffering. And this is why his owners got in touch with me and asked if I could get involved in his management. Whenever we see patients with chronic kidney disease and poor appetite, it's useful to think about why they might have that poor appetite. And there is quite a known checklist, if you like, of things to consider in this situation. And these are things that we can actively help. So what I would like to call a fixable problems that are worth looking for because we can address and reverse them. And examples of fixable problems which cause poor appetite in cats with CKD would include dehydration, and this middle photo is of a cat with very obvious skin tenting, quite severe dehydration evident clinically. That's clearly something we can correct through use of intravenous fluids and further fluid support. Other causes of poor appetite in a cat with kidney disease would include anemia, and so the cat on the left hand side of this slide has got, as you can see, very, very pale mucous membranes. The nose, the nares are deathly pale in this cat, and of course that's expected to cause quite obvious lethargy, weakness, and as a consequence of that, poor appetite. Electrolyte disturbances also can lead to poor appetite, and a very common cause of poor appetite in cats would be hypokalemia associated with chronic kidney disease. And again, that's something that we can fix, hence the picture of potassium chloride vials. We can add that to our intravenous fluids and or our subcutaneous fluids. We can add potassium orally, and therapeutic renal diets also have supplemented potassium. So there's lots of ways that we can correct that. And we also need to think about nausea and vomiting associated with kidney disease, and perhaps also concurrent issues. Many cats with kidney disease are older cats that may have chronic pain due to osteoarthritis or dental disease, for example. So looking at all of these and considering what we can do to help is, I think, a really important part of our management. In Buff's case, what we found was that certainly clinically he was a little bit dehydrated, and on his lab assessment you can see there are a number of abnormalities, including evidence of hemoconcentration, so evidence of dehydration, as well as a really severe azotemia. And whilst we shouldn't iris stage a patient that is dehydrated, we need to correct the dehydration first. It's very likely, and indeed it was the case in Buff, that he stayed in this very severe category of azotemia, iris stage 4, which is where creatinine is above 440 micromoles per litre. We do have some other changes on our blood profile. For example, his glucose is a little high, which is quite common in cats associated with stress, and he'd had quite a journey to get to the clinic, so that was certainly a possibility. His urinalysis also showed that he had very poorly concentrated urine. It was isosthenuric with a specific gravity of 10-11, so very compatible with his diagnosis of CKD, and also really shows us, well, this cat has a huge requirement for fluids because he's unable to concentrate his urine at all. So we had a number of things that certainly were a concern, but of prime importance at this point was rehydrating Buff, correcting his dehydration and reassessing everything, because his hematology was normal when he was dehydrated. That could have been masking an anemia, so really important that we checked that after correction of the dehydration. And in Buff's case, what we found was actually his hematology was okay, but he had this very severe renal azotemia. He remained in iris stage 4, and hydration was obviously going to be a significant challenge for him moving forwards. So that very importantly needed to be part of our plan with Buff in terms of supporting him. And in terms of support, as we'll talk about going forwards, feeding a wet diet is clearly something that is going to be very high on our list, and feeding a therapeutic renal diet also very high on our list for Buff because of his renal disease. And we know appetite with him has been a struggle. The hydration and the dehydration will certainly have been a factor there, but he has got very severe renal disease, so he may well benefit from some appetite support as well. His prognosis at this point was clearly very poor, and his owners were very much aware of this, but they felt that having been rehydrated, they wanted to really give everything as much of a go as possible at home. They really wanted to give him every chance, and they wanted him to be at home with them as much as possible. If he needed to go back to the clinic for more intravenous fluids, then that was a point where they were going to make that very difficult decision to euthanize him. So our intention with management with Buff really was to focus on what we could do to maintain his quality of life as best as possible. And there were lots of different elements of our management that we wanted to consider, but obviously from a hydration perspective, we know this is going to be a challenge. And so straight away, I recommended that as part of Buff's support, he had some subcutaneous fluid therapy at home administered by his owners. And this is something that many owners are actually very good following training at being able to do in their cats at home. And this still image on the slide is from a video that Buff's owners kindly sent to me, having started Buff's fluid therapy at home. And you can see he's very relaxed. He's having a cuddle. He's sitting in between his owner's legs while his other owner is administering the fluids. And this became a daily routine for Buff, where he would have some lactated ringers solution every day, starting started off at about 100 mils subcutaneously every day. And then as part of that, our management, I taught Buff's owners also how to assess hydration in him, so how to assess skin tinting, mucous membrane moistness, so that they could judge when he perhaps was a little bit dehydrated and needed more fluids, but also how to assess for absorption of the fluids we administered, so that if, for example, there was still a fluid bleb under the skin several hours after administration, that indicates, well, he doesn't need quite as much fluids because they're being very slowly absorbed. So let's maybe miss the next dose or reduce the size of the next dose, versus other occasions when clearly he was a little bit dehydrated and needed additional fluid support. And again, I often find many carers get very good at judging their cat's fluid requirements at home with support and tuition, obviously from their vet clinic. I was also worried about appetite support in Buff, so we decided to prescribe him some mirtazapine, which is a very effective antiemetic and appetite stimulating agent, which can be used on an every 48 hours dose frequency in cats with kidney disease. And I usually start at a dose of 1 milligram per cat every 48 hours, but it can be increased to 2 milligrams per cat every 48 hours if need be. From a hyperphosphatemia perspective, we wanted to support his hydration, so his kidneys were able to excrete the phosphate as best as possible, but also our therapeutic renal diet and additional phosphate binders were other strategies that we used. And the rationale behind these is that we know that phosphate retention commonly occurs in chronic kidney disease and contributes to progression of renal disease, and also contributes to our patients feeling unwell, hence being such an important thing to tackle. And lastly, Buff had also suffered more recently from episodes of constipation, and we suspected that was likely associated with his dehydration. So again, hydration support is going to benefit that. But something else that I often use in my constipated cats is polyethylene glycol 3350, which is an osmotic laxative, which comes in a powder format, which can be added to the food, very well tolerated and accepted by cats, and the dose can be adjusted to effect if needed to support constipation management. So quite a few things overall in Buff, but focusing on the fluid support, what could we do to really encourage him to drink more? And many of the tactics that I use, which will follow after this slide, are not sadly proven to be a guaranteed route to success in cats. For the small number of studies that have been done assessing certain of these tactics have generally been a bit inconclusive in terms of their efficacy. But I think in the individual, some of these strategies can be extremely effective. But the most effective overall is actually feeding a wet diet. So where at all possible, that's really something that we want to encourage. And this chart on this slide summarizes data from a number of publications where you can see that the daily water intake is much greater in those situations where a moist food, a food with a high moisture content, is being offered. So where at all possible, offering a wet food is really, I think, the most helpful strategy in terms of overall success at increasing fluid intake in our patients. Beyond feeding a wet food, what else can we do? Well, we can actually add water to the food. So even wet foods, we can make them even more moist than they are. And this cat was drinking a bowl of essentially a liquid food, and some cats will very happily tolerate that. They will eat a food that looks like a soup. So it's worth experimenting, and advise carers to just start very slowly, add perhaps a spoonful of water to the cat's food and mix it thoroughly and see how far you can push it, see how much of a liquid diet your cat is happy to take in. Of course, we want for Buff that food to be a therapeutic renal diet. And there are lots of different formulations available, some that are quite liquidy formulation as well. But I think the variety and having a range of renal diets to offer is also very helpful from an appetite perspective, because often we find that cats with kidney disease will need to cycle through these foods. They might like one for a few days and then they'll go off it and prefer a different one. So having a range of diets is definitely helpful. For those cats that really are what I call a dry food addict, then there still are some options. So firstly, for renal patients like Buff, if he would only eat a dry food rather, then it's really important that that's a renal diet, a therapeutic renal diet. Luckily for us, actually, he was quite happy to eat wet food, so this was not the problem for him. But in cats with kidney disease where they've really only ate the dry food, I will sometimes see if I can persuade them to eat that dry food with a little bit of water added. So in the same sort of way as I mentioned for the wet foods, you can add a spoonful of water to the dry food. It looks very unappealing to us, I would say, but actually there are some cats that will not eat the wet formulation of the therapeutic diet, but they will eat the dry formulation to which additional water is added. So it's worth a try. Drinking tactics in general, so thinking now about the water that we offer our cats. Firstly, there is some evidence that cats prefer to drink out of metal, glass or ceramic dishes rather than plastic. This is a generalization, so it may not be the same for all cats, but in general, I would say to my owners, really avoid the plastic bowls, focus on the glass, metal and ceramic options where possible, because we think that cats prefer those, and the hypothesis is that the plastic dishes may sometimes taint the taste of the water. They may affect the taste of the water, and that can be off-putting to some cats. Most cats also like shallow bowls. They don't like to put their head into a water bowl. They don't like the whiskers touching the side of the bowl. Again, this is a generalization because some cats like to drink out of a tall glass. But fill that to the brim, make sure there is an obvious meniscus for the cat. They do like to drink from bowls in that sort of way. And avoid having your food and water bowls too close together, which means avoiding double bowls, a bowl that has food one side and water the other side. And having a little bit of separation between the two is an advantage. Again, cats are thought not to like drinking in the same places that they eat. Having several bowls in all the areas that the cat spends time in is helpful, particularly for those cats with chronic health problems, which might make them more lethargic and struggle to find the energy to go and eat and to drink. Having them close by is definitely an advantage. Also, make sure that, of course, that water is clean, it's refreshed regularly, and that there are adequate numbers of resources for multi-cat households. So making sure that all of the social groups have free access to water. It's not limited at any point by any of the cats in the home. Somewhere calm and somewhere quiet for the cats to drink. For your older cats, it can be helpful to raise that water bowl. If they have arthritis affecting their neck and their legs, then it can make it uncomfortable crouching down to drink. So lifting up the bowl can be better tolerated and therefore support increased drinking from your cat. And some cats like moving water sources. So this is an example of where there have been some studies looking at whether having a water fountain does increase thirst in cats. And I think that the bottom line is that not in every cat, but in some cats, having a moving water source is likely to be beneficial. And experimenting with that, sometimes that means buying several water fountains to find one that your cat likes, can be helpful. And similarly, some cats will like dripping taps. And if owners know that and they're happy to leave a tap dripping, that can help support drinking in their cats. Similarly, some cats like climbing into the sink, climbing into the shower tray, and where that is a feature, having water pooled in there or dripping in there can be useful. The cat on the left swimming in the bath, quite an unusual thing, which hence including for a little bit of light relief at this point, but nonetheless, some cats do like jumping in the bath and they like drinking from a little puddle in there, so having a small amount of water in the bath, again, might support some cats and encourage drinking. Some cats like to play with their water, and this perhaps may encourage thirst in some situations. So having a ping pong ball in a bowl of water for the cat to sort of play with and encourage it to visit that water station and hopefully encourage some drinking might be an advantage. Some cats, as in the picture on the left-hand side, like to drink or lick the condensation from a defrosting bottle of water that's been in the freezer. So again, if you discover that your cat likes this, or the the owner discovers that the cat likes this, then supporting that can be helpful. And the cat shown in this picture did have chronic kidney disease, so this was part of a strategy that we used to support fluid intake in him. And really just experimenting would be another tip for carers. So trying different waters, perhaps tap water compared to mineral water, compared to collected rainwater, seeing if the cat has a preference, also experimenting with the temperature of the water. So mostly cats will tend not to like things icy cold, but of course Tebow in this top picture is an exception to that. Perhaps warming the water slightly might be popular with some cats. And trying really just to encourage your carers to try these tactics. And there are ways we can monitor the success of the tactics, as I'll mention through this presentation. We can also make tasty liquids for our cats. So for a cat with kidney disease, one option might be to poach some chicken or fish in a pan of water, and then they eat the chicken or fish, or they give it to another animal that doesn't have kidney disease, but then they let the water that has been used to poach that chicken or fish cool down, and that becomes a tasty drink for the cat. And if that's popular, they can consider freezing that liquid in an ice cube tray and then pop out a cube of that sort of infusion to add to the cat's normal water bowls to just gently flavour that for future use. Other options are as listed on this slide as well. So the spring water from a tin of tuna, the water from a bag of frozen prawns as that defrosts. And of course, if your cat doesn't have kidney disease, then you could liquidize that those prawns in water, or you could also feed that chicken or fish that you poached earlier. I'm just focusing on buff here by avoiding those extra sources of protein and phosphate. A more recent option is as a nutrient-enriched soft jelly, which appears to be very palatable to cats, and a study showed that the cats therefore increased their fluid intake and reduced the concentration of their urine. So this could also be a useful tactic to consider in all of your patients where you're wanting to support drinking and hydration. There are some liquids we want to avoid, so salty liquids in general, such as brine. If you have your tuna in salt water, that would be perhaps a less good liquid to offer to your cat. For cats with kidney disease, milk is something that is a little bit contraindicated because it has high levels of phosphate in it. And also cats can't digest milk in any case, so it can potentially cause diarrhea in some cats as well. And we also need to be mindful of the fact that cats cannot tolerate onion or garlic. So if we are using any stock, for example, it mustn't contain onions or garlic, or that does risk causing adverse effects in our cats. So how can we monitor the success of our tactics? Well, in Buff's case, of course, it was going to be a combination of things. So how was he doing clinically? Was he bright? Was his appetite good? Were there indications that his hydration was under control? But also, as I explained earlier on, we did talk to his owners about how they could assess hydration at home, such as through skin tenting, as shown in that short little video there, feeling the mucous membranes to see if they felt moist, or whether they felt sticky and dry in a cat that is dehydrated. And also, of course, our lab parameters, we could look at that as well to get clues of dehydration. So a range of tactics available to us for Buff. And I'm happy to say that in Buff's case, really we were able to keep him at home with a really superb quality of life for an additional 4 months after the point where I first saw him. And given the severity of his renal disease, that very severe Iris stage 4 renal disease, his owners were absolutely delighted that he had this good quality, excellent quality of time with them at home. This is him sunbathing later on in the year. And as things did progress and his renal disease did deteriorate, they made that difficult decision to euthanize him, but were very happy that they'd had that really good quality few months of time with him. So let's move on and talk about another case where encouraging drinking is going to be helpful. This is Leo, and Leo is a 9-year-old male neutered domestic short hair with a history of lower urinary tract disease. He was always reported to be quite an anxious cat. He was a rescued cat, always very much hiding at the vet clinic, often hiding at home if there were any visitors. But his recent problem was that he'd had episodes of lower urinary tract disease characterized by some dysuria and hematuria, some inappropriate locations used to pass urine, and he'd shown signs of discomfort and distress during these episodes. So we needed to obviously investigate the cause of his lower urinary tract disease in a little bit more detail, given that this was a severe and recurrent problem. And what we found was that his urine was very concentrated. It was very hematuric, as you can see in that picture above him on this slide, but there was no evidence of bacterial urinary tract infection. Also, on further investigations, no evidence of urolithiasis, neoplasia, or other structural abnormalities. And so we made a diagnosis of exclusion, which was feline idiopathic cystitis. And management of feline idiopathic cystitis is often quite challenging. My summary overall for this condition would be that firstly, we look at the household in detail, and in particular whether there are any sources of stress that we can address. We know that many cats with idiopathic cystitis have a defective stress response, so they're unable to cope with stress effectively, and that is manifested as lower urinary and other signs. So if we can identify, for example, tension in the household and address that, then that's going to be a really important part of our management. Also, very importantly, as you can see here, is increasing fluid intake where possible to produce more dilute urine. To look at the diet, there are some therapeutic urinary diets available, and there are some rationale for using those in cats with idiopathic cystitis. Also, obesity management where relevant. You could see Leo is a little bit overweight, was going to be an important component of management here. There are some other medications which sometimes we need to use as part of our management of idiopathic cystitis, and we also need very much to educate our owner as to what we know about this condition and how best to manage it in the home, because much of the management when looking at stress and also water intake really relies on them being part of the management and helping us to manage this condition. So why is it useful to increase water intake in cats with idiopathic cystitis? Well, this is something that we first learned about 20 years ago through a study that was published showing that the recurrence of feline idiopathic cystitis was very much lower in cats fed a wet therapeutic urinary diet versus the same diet but in a dry formulation. And the results of that study are shown graphically here, where you can see the recurrence rate was 11% on diet B compared to 39% on diet A, and diet B was the wet food. And there are a number of reasons why it has been suggested that feeding a wet diet to cats with idiopathic cystitis might be helpful in terms of, for example, diluting painful or noxious substances in the urine that might irritate the lining of the bladder, encouraging these cats that often tend to be overweight and sedentary and inactive to urinate more frequently, pass a larger volume of more dilute urine, perhaps also some element of environmental enrichment in feeding a wet food. All sorts of things have been considered, but the bottom line is that it certainly did appear from this study, and I think from my own clinical experience and that of many others, that feeding a wet diet was helpful. Encouraging water intake was helpful in terms of reducing recurrence. So this is really an important component of management, something that I spend a lot of time talking about to carers of cats with idiopathic cystitis, such as Leo's owners, and something that we were keen to address using all those same strategies that we talked about with Buff. Ideally, that wet food, if at all possible. For dry food addicts, definitely I would use, where possible, a therapeutic urinary diet, and that's because that diet has been formulated to support urinary health, but also some of these diets have got additional sodium chloride within the food that stimulates thirst and drinking and is successful in reducing urine-specific gravity as well. So a number of reasons why that dry urinary diet is better than any other dry foods that the cat might prefer to eat. But where possible, a wet food is certainly my preference, and all those strategies as illustrated here and that we've talked about previously. In terms of monitoring success of our interventions, for cats with idiopathic cystitis, of course, the bottom line is recurrence of clinical signs. And that typically is something very easy for an owner to monitor, because this is quite a distressing condition. So if we can see that, yes, we haven't got recurrence, we know we're doing a good job. But we also can look at the urine specific gravity through owner collected urine samples with the cat at home, and see whether we have been successful in reducing the urine specific gravity. And as you'll remember, Buff's urine was very concentrated. Ideally for a cat with idiopathic cystitis, if we can get the urine specific gravity below 1040, even better if below 1035, then that's a brilliant job. Other ways we can monitor success at home in terms of increased urination would be to look at what's been produced in the litter tray. And if the cat is using a litter tray, then I would recommend a fine, sandy consistency clumping cat litter where possible. And one of the reasons for this, for using a clumping litter, is that then we can actually monitor how many times a day the cat is passing urine, and also the size, perhaps even the weight of that urine ball, so that we have an indication of success again of our strategies. And we ideally, of course, are looking for large urine balls and an increased number of urinations in cats like Leo where at all possible. Some of my carers go one step further. So this is a patient of mine called Shy. Shy has sadly had episodes of lower urinary tract disease for several years now. And as part of his monitoring strategy, his owner has set up a webcam, which is now rechristened the WeCam, which observes his litter box. And when Shy goes into the litter box, she can then start to record what is going on without intimidating him by going to watch him in person, and she can see how long it takes for him to pass urine, and then she can, after he's left the tray, go and see what sort of volume of urine has been passed. And unfortunately, during an episode of disease, which Shy is in the video that's being shown at the moment, what you can see is that he spends a very, very long time on the tray, ultimately passing quite a small volume of urine. And this video goes on for several more minutes, which I won't put you through, but really useful data that's provided that tells us that unfortunately at this time his urinary signs are not under control. So what about Leo? Well, strategies to encourage his fluid intake were very successful, and his owner really liked to be involved in this aspect of care. So collected urine samples at home, which we were able to assess in terms of urine specific gravity, and we were able to bring his urine specific gravity below 1040. So very good motivational result there for them, and reinforces the messages that we're giving, that this is a useful thing because he has had reduced recurrence since doing that. That's not the only thing that we have done. We have made some environmental modifications at home, providing him with more hiding places, more high up places to go to as well, using the vertical space, which he's really enjoyed. And he also has received some of these anti-anxiety nutraceutical supplements, alpha-casosapine and L-tryptophan, which may have an impact to reduce anxiety in some vulnerable cats. He's certainly been a little bit more confident with visitors in the house since receiving these supplements. He's lost a little bit of weight, but as you can see from the photo, we've definitely still got some work to do there. But the bottom line is that his idiopathic cystitis now appears to be very well managed. So this strategy has been a success there. And the last case to talk about is a cat called Boris, who you can see here reclining and relaxing at home. Boris is a very old cat. He's 19 years old, male neutered domestic short hair. He's had hypothyroidism for a few years now, but this has been very well managed with oral thiamazole. And he recently came in for a general health check to see not only how his hypothyroidism was doing, but also how he was doing otherwise. And what we found was that he now has got some additional problems. And the most concerning of these additional problems was that his blood pressure has shot up. So his systolic blood pressure readings were around about 200 millimeters of mercury, which is very high. And in addition to that, we could see ocular manifestations of systemic hypertension in that he had bilateral retinal edema and some detachment. So we knew that that high reading was genuine, not just due to stress, because we could see that target organ damage. And that's something that, if left untreated, certainly risks him developing blindness, which is generally permanent, but also other consequences such as bleeding into the central nervous system. He does also have some dental disease in addition to his high blood pressure, and we found that he had lost a little bit of weight recently, possibly because of his dental disease affecting his appetite, but of course there are other possibilities as well, and we very much wanted to assess those. So we collected some blood and some urine samples from Boris, and what we were able to determine from those was that his hypothyroidism was still very well controlled. His T4 result was right in the middle of the reference range, so really absolutely where I would want it to be. Very happy with that. But we could see that his urine specific gravity now has dropped. He has also this isostenuria, urine that's very, very minimally concentrated, specific gravity 1020, and his urea was a little bit high, and this was a fasted blood sample. Whilst his SDMA level was normal, his creatinine is a little bit above the iris cutoff of 140. So in combination, these findings, that reduced urine specific gravity and that mild azotemia, are most likely to suggest early stage 2 renal disease in Boris. And at the age of 19, that's really not unusual. As we know, this is a very, very common condition. He does have also hyperglycemia. He's actually quite frequently had hyperglycemia when he's been in for assessments. He does get a little bit stressed coming in, and certainly that was our first thought. There was no glycosuria, and we actually did check his fructosamine levels as well as a more long-term indication of what his blood glucose had been doing, and that was fine. So our assumption was that, as with previous occasions, his hypoglycemia, whilst quite high for stress, was related to stress, but clearly we'll keep an eye on that as well. So our assessment for Boris is that his hypothyroidism is under control, but his recent weight loss may be related partly to his dental disease, partly to his early renal disease, or perhaps due to both of these. And of course, in the short term, the most pressing thing that we need to treat is his systemic hypertension, but we need to make sure in the longer term we don't forget the other aspects of his care. So our management plan for Boris includes treating his hypothyroidism as before, so we're continuing the same dose of thiamazole. We're stabilizing his systemic hypertension at the moment, so he's receiving amlodipine for that, and he's due for a checkup next week, in fact, so we'll see how his blood pressure is doing. And if we can stabilize his blood pressure, then we would hope to be able to perform dental surgery in him so that we can address his dental disease, because clearly untreated, that's something that will only get worse, and his kidney disease is likely to also get worse with time. So if we can, we would like to treat his dental disease as soon as possible. But he quite clearly is a cat that is going to benefit from supportive hydration moving forwards. He has this poorly concentrated urine, so he will need to drink quite a lot to maintain hydration. He is an elderly cat. He may well have some osteoarthritis. He may have some mobility problems, although this has not been something that his owner is aware of, but that could affect his drinking. Also, he's very much likely to suffer from cognitive dysfunction syndrome at his age, or at least some aspects of that. So we need to support him by having plenty of water bowls in all of the areas of the house that he spends time in, and really focusing in the same way that we have done with Leo and Buff to really support his fluid intake and support him so that he maintains his hydration, and that supports his kidney function as best as possible. So ideally, wet foods and all those tactics that we've talked about, and I hope we'll be successful in stabilizing him so he can have that dental treatment that he needs. So in summary, I hope through these cases that it's been possible to show how we can make an impact to quality of life. We can have an impact on our disease recurrence in some situations through focusing on increasing water intake. And whilst there is perhaps not a one-size-fits-all approach that we can use for every cat, there are certain things that I think we do know. For a start, that feeding a wet food where at all possible is likely to have the biggest impact on water intake per day, but that for individual cats, other things can make a big difference, whether that's offering that defrosting bottle of water that the cat likes licking the condensation of, or making a prawn flavored soup, offering water fountains, a shower, all those sorts of things for the individual can make a difference. And there are ways that we can monitor and our carers can monitor success in our individual cases, as we've shown for Buff and Leo, and hopefully provide the best quality of life for as long as possible for those cats with chronic conditions like kidney disease, but for those cats with urinary problems, reduce recurrence of the problem. Thank you very much for choosing to listen to this session. I do hope you found it helpful.
All right. Thank you so much for being with us during the webinar, and we're happy to answer any of the questions that you might have. I know that there are a couple of questions, and we have Dr. Sarah joining us in order to reply. Hi, Dr. Sarah. Can you hear us well?
I can hear you. Can you hear me all right?
Yes, all well, all well.
Perfect. It seems a little bit slow over all of these thousands of miles, but I hope you can see me and hear me clearly, and I'm very happy to be here. So I have some questions as well. Would you like me just to go through the questions now, Daria? Is that
yes, I think it would be
Yes.
it would be great. Yes, if you can just start with the first one that we have on chat and just go one by one.
Lovely, I'll do that. So the first question I can see related to Buff. Buff is the first case that I discussed in the presentation, a cat with chronic kidney disease that benefited a lot from support with hydration. And the question was, what are the other behavioural indicators that were noticed with his improvement? And the answer to that is that for Buff, the main concerns that his owners had were that he was quite depressed and lethargic. He had quite a poor appetite and general poor demeanor, I would say. So correcting his hydration status and supporting that, as well as the other things that we were also doing to support his kidney disease, really made a big difference. So he was much brighter, much happier. His quality of life was very much improved by the treatments that we were able to offer. I can also see some more questions. So the next one I can see is, firstly, are there any side effects of a high salt diet for an animal with kidney disease? And the answer to that, firstly, is that certainly in general we would want to have a low sodium diet for cats with renal disease in view of the potential for salt burden, and in particular thinking of the risk of that contributing to or exacerbating systemic hypertension, high blood pressure. So most therapeutic renal diets will be low in sodium, partly with that in mind, and also just in general support of other electrolytes. So calcium balance, it also becomes often important in cats with renal disease, and there is often an interaction between all of these electrolytes. So typically a low sodium diet that would be recommended. The second question was anti-anxiety treatments. and I'm not sure which of these was popped up in. I'm trying to think. With buff, was that the mirtazapine that we're referring to? I'm not sure. I guess I might need, if you've got the opportunity to put a more specific product that I used, I might be able to come up with an alternative. Often, certainly in the UK even, we're for cats sometimes having to use products that are not necessarily veterinary authorised for cats. If there is no authorised product, then we are legally allowed to use products that are either authorised for another species or for people if there is not a sort of cat product available. So sorry, that's not as full an answer as perhaps you might like, but feel free to add an extra question. The next question I can see is there any recommendation in terms of the ratio between dry and wet food when mixed feeding? I think the answer to that for me would be very much according to the patient's needs. If I am particularly concerned about hydration support or wanting fluid intake, for example, a cat with urinary issues as well, then my preference would be to focus, if at all possible, on a wet diet 100%, because we know that that is the most effective way of getting water into our patients compared to even some of the dry foods that have added salt in that stimulates thirst. But if we're dealing with a healthy animal, and often it's an advantage to have a mixture of formulations, there are always very keenly discussed advantages and disadvantages of wet versus dry food. So, for example, many people would feel that a dry food is better from a dental perspective. Then obviously mixed feeding is absolutely fine. And I think the balance really probably depends on that individual cat and their clinical circumstances. But certainly for those cats with kidney disease where we really want to focus on hydration support as well, where possible, I would want that cat to eat a totally wet diet. But if that cat is what I would call a dry food addict, if it's a cat that really likes having dry food a lot and is resistant to completely transitioning to that wet food, then as long as it's a therapeutic dry diet, so a dry diet formulated for a cat with kidney disease, then that is an appropriate choice to give that cat. And that's where also, of course, all the strategies that I talked about in the presentation would very much come into play to try and increase water intake in other ways. How much water should a normal cat drink a day? Well, again, that sadly is not as easy a question to answer as it is to ask, in that in a healthy cat, we know that they need broadly 50 mils per kilo per day, but they will get water through their food as well as through drinking. And so it depends on what sort of food the cat is eating as to how much it actually needs to drink on top of that. And then, of course, whether the cat has increased losses because of a medical condition. So a cat with chronic kidney disease may need to drink 300 or 400 mils a day, maybe up to 100 mils per kilo body weight, because it is losing excessive amounts of fluid through its kidneys into its urine. So the absolute requirements in terms of how much a cat needs to drink will vary a lot according to the individual, its health status, the diet it's receiving, also how active it is, and the climate can have an impact. So, for example, many of you, I think, will be tuning in from very much warmer climates than I live in. I live in Scotland, in the very north of the UK, and so we don't have very hot weather. But if you are somewhere where the weather is extremely hot, then you will know that cats, a way of keeping cool is to groom. And that, of course, leads to evaporation of their saliva, and that helps the cat to keep cool in a hot temperature, but it means that the cat will need to drink more fluids to maintain their hydration. Next question, are owners able to notice early signs of dehydration? Well, I do encourage owners of cats with chronic health conditions like kidney disease to teach themselves to a certain extent things like assessment of hydration, so skin tenting, for example. This is where we lift up the skin behind the cat's neck and see how quickly it comes down again, and so the owners get an idea of what is normal for their cat and therefore can spot signs of dehydration, such as that prolonged skin tenting. Also, some cats, particularly older cats, might be quite comfortable for an owner to actually lift up the cat's lip and touch the gum and see if it feels moist or whether it feels dry and sticky in a cat that might be dehydrated. So I do find often many of the people I deal with, who tend to be very dedicated owners, will actually over a period of time often get very, very good at understanding their cat's needs and being able to detect subtle signs of dehydration. And they will of course see the behavioural changes that accompany a cat that's dehydrated, because very typically a cat that's dehydrated will start to be a little bit lethargic, it's less likely to eat, and so the owner may notice things like that as well. So whilst it's something that, you know, I would always say to them, if you are not sure, please bring your cat in to see me. Often many owners, I think, can make some judgment about hydration looking at their own cat. We have another question about genetics and cat hydration or dehydration. And that's an interesting question. I'm not sure that I can probably answer that, to be perfectly honest. Certainly cats overall as a species are very, very well adapted to cope with very little water. Their nephrons have very, very long loops of Henle, these long ducts in the nephron which allow water absorption. And although cats have far fewer nephrons within their kidneys than either dogs or people, because they have these very long loops of Henle, they are superbly adapted to concentrate water and to have very low fluid requirements. So the genetics of them as a species, if you like, certainly very much supports them being very good at managing their water requirements. Whether there are individual genetic variations between breeds of cats that influence that further, I'm not sure, and I'm not sure that research has been done. So it's a very interesting question. So I'm seeing here, this may be where the anxiety medication came in. So I'm just trying to see the full question, but there's always a little bit of a delay for my loading the full question. So nutraceutical anxiolytic medications for patients that I've used. So the nutraceutical anxiety relieving medications that I've typically had most experience of are alpha casosapine, which is also known as a milk hydrolysate, and this is a sort of milk protein that binds to I think it's the GABA receptor and can have some anxiety alleviating impact. And this is a substance that has been supplemented to some veterinary diets as well. For example, Royal Canin's Calm diet, I believe, and also Hill's CD Stress have this alpha casosapine added to it. There's not a huge amount of data in terms of its efficacy in cats, but there is some data, including some urinary case series where the cat's behaviour, there's indications that the behaviour was improved and that the recurrence of disease was also reduced by addition of that sort of substance. L-tryptophan is the other nutritional supplement that's often used, and that certainly also is in I think both of the diets that I've mentioned as well. Possibly a little bit less published data on that, but I guess from my perspective they're certainly not going to cause any harm, and combined with other strategies aimed at reducing the impact of stress in my patients can be certainly I would say anecdotally of benefits in these sort of cases as well. So you may be able to find them available as separate supplements, or you may be able to access some of the diets that I've referenced if that's of interest to you. Certainly in the UK there's a lot of the different supplements available, and there may be possibilities of getting hold of those in your countries as well. Looking down, so I hope that's covered enough about the anxiolytic medications. I think they're really, as I say, they're supplements. It's not a drug that's being used, but I think supportive for stress associated conditions. For cats that eat household food, what are the recommendations for proper hydration? So I guess I'm assuming by the term household food that you're maybe talking about food that might be intended for a person, that the cat is having perhaps, you know, any leftovers from feeding the family. That may not be correct. I think certainly typically in the UK, cats are typically fed cat food, so food that's designed just for the cats, and most of the clients that I see in my clinic are feeding a mixture of dry cat food and wet cat food. For sort of human food, if you like, leftovers, the main concern would of course be that it may not be appropriately balanced for the cat's needs, and there are a whole host of problems that we can see if we're not feeding a nutritionally balanced diet, and certainly an all meat diet is going to be deficient in calcium, for example, but there are cats have a very high protein requirement, certain essential fatty acids and amino acids that are meat based, so they absolutely have to have a meat containing or an animal protein containing diet. Cats can't be vegetarian as well, otherwise you will see issues. So I haven't really spoken much about hydration there, and I guess that if any diet that the cat is receiving, if it is either the diet the cat has always been used to or the change is made gradually, as long as they have access to water at all times, if they are healthy, then they will be able to adjust their water intake to adapt to whatever diet they're eating, and therefore not be dehydrated. The main concern would always be any sudden changes in diet or any health changes in the animal that might have an impact on their fluid requirements. Is there a difference between cat breeds when it comes to hydration? I would say, from my experience overall, probably not for the breeds of cats that I see. I think some cats, it can be skin tenting, can be a little bit different in terms of skin elasticity, so that can affect the interpretation of things a little bit, but by and large I would say from my experience it's that there's not strong breed related differences which I would feel important for you to know about based on what I see in the cats that come into me. I think that's all the questions that I can see. If there are any that I've missed, feel free to point them out, and I'll keep an eye for any new ones coming through as well.
Yeah, I think that so far we answered all the questions from the participants, from the attendees. So it's, if in case no other questions are raised now in the next couple of minutes, we encourage everyone to please contact us directly. We're happy to answer the questions by email later on. So always there to support on the respective topic. So welcome everyone. So let's wait a couple of more minutes, but I think we had a good Q&A session. A lot of questions were raised and answered. So thank you so much, Dr. Sarah. It was really interesting.
That's my pleasure, and yes, I'm happy to stay as long as needed. If people do have questions, then then I'm here. And also, please do feel free to visit my website as well for lots of free to access resources. There's lots of webinars on there. That's vetprofessionals.com, and hopefully will complement nicely what you've heard today as well.
Definitely. Thank you so much for your suggestion. I don't see any more question in the chat anymore. I'm just refreshing my Q&A section. Yes, it seems like we answered all of them. So if that's the case, I just wanted to say again a huge thank you for our great speaker, for Dr. Sara. It was a pleasure having you today, and thank you so much for all the participants that joined our webinar. We'll stay connected and answer all your upcoming questions. Thank you so much.
Thank you. Thank you, everyone.
Good night, everyone.